An important question is, why do people use drugs? I think that's a bad question. The question should be, for me, why don't people use drugs? As humans, we know, for example, how to use drugs to enhance our experience, our functioning. There are many people in Brazil and the United States who use caffeine when they wake up in order to help them be more alert in the daytime. And that's what that drug does. And there are other people in these societies who use alcohol to relax and make social interactions at a party better. And so that's why those people use that drugs. And so if we ask, why would someone use crack cocaine? Crack cocaine, or cocaine, any cocaine, for example, is a drug that will make you more alert and enhance social interactions. And so that's why people may use crack cocaine, while people may use a drug like heroin. They may want to relax, they may want to decrease their anxiety, they may want to relieve some pain. All of those kinds of things are why those folks use drugs. And so when the question is, so why don't other people use drugs to enhance their experience? Maybe they don't know how to use the drugs. And that's a good thing if they don't use drugs, if they don't know how. But why people use drugs or why people don't use drugs is a very different question for why do people become addicted? That's an important question that the society is interested in. But the first thing society should understand is that only 10 to 20% of the people who use drugs become addicted. And if that's the case, then the society should understand that since we only have a small proportion of users who become addicted, they must understand that the problem itself can't be the drug. The problem can't be the drug if most of the people who use the drug don't have an addiction or a problem. Now it allows you to really try to peel back the layers and understand why those people are having problems. And people have problems with their drug use for a variety of reasons. One person may be addicted to crack for one reason versus another person who may be addicted for another reason. And we have to understand why each person are addicted. Some people might be addicted to crack because they have a co-occurring psychiatric illness, depression, anxiety, or something of that nature, and they're using the drug to treat that illness. Or other people may become addicted to crack because it's the best available alternative to them at that time or at that point in their life. And so their choice to use crack is actually rational and reasonable. Another person may be addicted because they just have not learned how to temper their behavior in any domain, whether it's drug-taking behavior, whether it's sexual behavior, whether it is driving an automobile irresponsibly. So people become addicted for a variety of reasons. And when someone tells you that addiction is because of this one reason, that's a license for you to stop listening.